My name is Kenny John, and this week is my last week of anesthesia training before I go on to become a critical care fellow. With these 3 years of anesthesia training coming to an end, I thought it would be appropriate to leave you guys off with 3 pieces of advice of interpersonal skills. If you watched my previous video, that was 3 pieces of advice for clinical skills. But this video is going to be all about how to function well as a team member in an operating room setting. So my first piece of advice is recognize who the most important person is in the room. That's the patient that we're all taking care of. Anesthesia providers, we're meeting these patients for the first time the morning or afternoon of their surgery. And so our first impression is happening when they're at their most vulnerable point. In this short amount of time, not only do we have to explain how we're going to provide anesthesia, explain the risks involved, but we also have to build the trust of the patient to let them know that we're going to deliver the best possible care that we can. Now, I have my usual spiel that I do for explaining general anesthesia, modern anesthesia care, different regional blocks that we do, different procedures that are involved in anesthesia. So a lot of that just sort of is a routine that you build up over time. However, building the trust of your patient, that's something you have to sort of tailor to each individual patient and figure out what works and what doesn't work. Some patients respond really well to humor. Other patients respond really well to you just being straight up and stern with them about what to expect. What I found to be most successful is just getting personal with the patient, asking them where they're from, how many kids do they have, just something personal about their life that's unrelated to the medical care that they're getting. This immediately makes the patient feel like they're not just looking at them like a patient, but you're looking at them like a human, and you really do care about who they are and what's going to happen to them today. A lot of patients are coming to you anticipating the surgery for weeks or even months, and this is maybe one of the biggest days of their lives. So just being able to be a friendly face and a friendly voice to kind of guide them through this process is something that we should really hold dearly to our profession. My second piece of advice is know the names of who you're working with, especially in the operating room. That includes the surgical residents that you're working with, your surgical attending, most importantly, the circulating nurse, as well as the scrub tech. The circulating nurse and the scrub tech are probably going to be the 2 people who are in the operating room when you need them the most and when other people seem to have disappeared. That's usually when we're putting the patient to sleep or when the patient's waking up. Now, the joke in anesthesia is that everyone sort of refers to us as the collective whole anesthesia. For example, throughout your training, you're going to hear move the C-arm up towards anesthesia, push this or that up towards anesthesia. Anesthesia, are you ready to check in? But if you're reasonable enough to kind of introduce yourself and get to know people on a first name basis, before you know it, people are going to start calling you Kenny instead of anesthesia. These may seem like very minor victories in life, but I can tell you that being able to communicate with somebody by name is very crucial and very helpful, especially in times of panic. When you're having situations where you need to move very quickly and you need to call for help, being able to refer to the nurse by their name is probably the quickest and most effective way to get their attention and to make things happen as quickly as possible. Again, same with the patient. It also is just a sign of respect that you're not just viewing this person as someone who's transient and that you're not going to have to worry about, because most likely you're going to work with this person again. So taking the extra time to just learn someone's name and get to know them on a personal level makes it that much easier to work alongside each other. And my last piece of advice, and maybe most important piece of advice, is know when to speak up and don't let yourself hesitate if you feel like something wrong is happening in a case. Now, when you're first starting off, it's probably going to be very easy to feel like everything is going wrong and nothing seems like it's normal. And maybe the first place you go to is the attending that's covering you for that case. But eventually you're going to have significantly sick events happen in your OR case where you're going to have to alert the surgical team and you're going to have to alert them promptly. Being able to develop this confidence and this voice to be able to speak up, especially when you're the only one paying attention to the hemodynamics or how the patient's doing globally, is going to be really important in situations where the surgeon may not realize something's wrong or the circulating nurse may not realize something's wrong, and you might be the only voice to really say something in that moment. This is something that only gets better with time, and the more you practice it and the more you work with different surgeons, the more of a rapport you build with them and the more comfortable you get speaking to them. But it's really important that if you feel like something is not right, you speak up, because if you don't, before you know it, something bad's going to be happening for an extended period of time, and then it could be too late by the time you mention it. So anyone who's going into anesthesia or just starting their anesthesia training career, I hope this advice has been helpful, and I hope you enjoy the path. This is one of the best fields in medicine, and I'm super happy that I found myself in it, and I'm very excited to bring you all some stories from critical care medicine in the near future.